In a healthcare sector as under strain as the South African healthcare sector is, we're seeing the rise now of a new type of private practice, the nurse-led private practice. Nurse entrepreneurs are taking this responsibility seriously, and they're going to the communities and serving their communities at a primary care level. It's a new type of healthcare service, and really a type of healthcare service that not many people really know about. And patients are now becoming more and more aware that these type of services exist. Nurse entrepreneurs are making their mark in the South African healthcare landscape, and I'm so privileged today to speak to Sister Cleopatra van der Ster Ngcoyi, who will be really helping us to unpack essentially where the nurse-led entrepreneurship movement finds itself right now, what they need to do if they want to be successful, and some interesting events and happenings within the space. Sister, thank you so much for taking the time to sit down with me today. I really appreciate it. We've known each other for quite some time.
Yes.
I've spoken at one or two of your events, or at least our company has, and I'm always so inspired by the people in the room. You're seeing people who otherwise you would not think that they would actually start a business, really beginning to dream and think about what a practice or private practice that is led by a nurse could look like. But you've been in the sector now for over 24 years. I don't want to give your age away, but you've been there now for quite some time. You've seen the space develop and flourish over the last couple of years. But maybe just a little bit about you and where you started. I mean, you've been in academia, you've lectured nurses, you've done you paid your dues in the hospital sector, and now you own Nurse It, which is your own healthcare practice, your own nurse-led private practice. So thank you for taking the time to come onto the show with us at Vital Insight. And please do help us understand how you ended up in the space. Tell us a little bit about your journey.
Thank you for inviting me.
Big pleasure.
And thank you for letting me talk about my journey and also empowering nurses that will be listening or anybody in the healthcare sector. So I started my practice in 2017, but before starting my practice, I first had to obviously do my 4-year qualification, which made me a registered nurse.
Mm-hmm.
And then I went to go specialize because I wanted to be a primary healthcare nursing practitioner. And after that, I went to go do primary healthcare. Then I went to do education. I did my master's degree. I did occupational healthcare. And way back when I was in my 20s, I actually did it. And today it's benefiting me because through those process, I actually thought I just wanted to be a nursing lecturer. I want to teach people because I knew I loved the clinical side of nursing.
Yes.
I never knew that I was going to venture into actually opening my practice. But in 2017, I opened my own practice because I actually loved servicing people. I actually love seeing people. So I was working as a lecturer at university, and then after hours, I would come and see patients. After hours, I would book clients to see clients actually. So in 2017, I landed my dream job of becoming a lecturer.
Yes, yes.
And I opened my own practice at the same time. So it was almost like a dilemma. A dream versus what I love.
Yes.
So the dream was to become a lecturer all my whole career. That's why I studied so much.
Yes.
And then versus the love for the clinical, seeing the actual patients, examining them, and sometimes finding things that others couldn't find.
Yes. No.
So it makes it so interesting, and then seeing different people all the time. So today we'll see this kind of person, tomorrow you will see that kind of person. And also with my journey as a nurse practitioner, I've actually seen people give birth to their patient, to their babies.
Yes.
That was part of our practice. Now the babies became our patients, and they're also knowing us. They are engaging with us. They even walk in themselves, the babies, and that journey was just amazing for me.
And I mean that tension that you had now. I mean, you spent all this time upskilling yourself to get you to the point of becoming a lecturer, but now you're seeing you're getting the joy out of dealing directly with patients, seeing patients directly in your own facility, something that you get to direct the vision of, that you get to grow, that you get to plan and plot and really see impact within your community. I think the question I want to ask is, what gave you the sort of guts to actually go out there and open up this practice when nurse practices there wasn't really a lot of people who knew that nurses could even own private practices? What gave you the boldness to go and make that decision?
If I would say I was bold, I wasn't going to lie. I was actually just so scared, but also didn't want to give up. I also wanted to service the people. So I think sometimes we have to overcome our greatest fear.
Sure.
And actually, if we overcome our greatest fear, we can actually be successful. So way back in 2017, nurse-led practices or nurses opening their practices were not known. It wasn't a common thing in the field. And I was scared because are people going to support me? Are people going to actually come? But amazingly, on the first day, we had one client. Every day, our clientele grew. So every day, we saw clients, our clientele grew. And in 2020, I actually decided just before COVID to go full time into clients. So seeing people into my private practice, into just seeing clients and being there for the clients, because I couldn't divide my time anymore between doing my full time job and then also seeing amount of patients. Actually, I couldn't service a growing practice and service my career as a lecturer. So my practice was growing, the patient numbers were increasing, the demand was increasing versus my actual job. And then I had to decide, Cleo, where do you see yourself in 10 years? Where do you see yourself in 20 years? And I see myself servicing the community. I see myself being in the gap, standing in the gap, not only running my own business, but also servicing the people that need the services most. So way back in 2017, I started my practice not knowing where. I didn't know what was a business plan. I didn't know that all these CIPC, business registrations,
BHF registrations,
all those private practice registrations, I didn't know about that. We had our container, we purchased the stock, we had our qualification, and we had a skill. We applied by pharmaceutical companies way back to get our medication because we had our dispensing licenses, etc. We had our post-basic qualifications, so we started. Then afterwards, I realized, but people are coming to ask me, can I use my medical aid here? So now, if you need to claim my medical aid, you need to have a private practice number. So then I actually find out, no, I need to go Google. But then I just realized that there's no guide for nurses on how to open their own practice because it's not a common thing. So we had to navigate through the process of actually getting compliance. But within our first year, we managed to get, of opening our practice, we managed to at least get our business registered, to at least get our private practice number, at least to officially now we're a company. We have a company registration number and all those things. But initially when I started, I just thought I'm opening my own practice, not knowing, besides the clinical part of things, the clinical side of seeing patients,
this whole other thing.
There's the whole other business model that needs to be you need to adhere to. There's legislation, there's registrations. So
I want to get to that in a second because there's a whole lot we need to unpack over there. There's a whole other movement that you are involved in that I want to unpack with. But before we get there, I think just to those colleagues and listeners that maybe don't really understand what the scope of a nurse-led private practice is, like what can nurses actually do in private practice? So maybe give us the scope. Like what do you see on a day-to-day basis, and what are nurses actually able to do in private practice if they are a nurse-led private practice?
Nurses can do anything.
Okay, that's broad.
So in our practice, I'm referring to myself. In our practice, we do primary healthcare. So we do your basic conditions, primary healthcare conditions. Then we do your basic suturing. We do postnatal. We do antenatal care. We do immunizations. We do family planning. We do everything from your normal wound care. So our practice is focused on providing primary healthcare services. But we also do occupational healthcare. So we're also venturing because I have the postgraduate qualification in occupational health. So I'm a qualified occupational health nursing practitioner. So I also do occupational healthcare. So that is those medicals, the medical surveillances, the pre-medicals, the baselines, all those medicals we do for companies.
Got you.
We do for individuals as well. And so nurses can do anything. So a nurse don't need to do everything if she's not fully qualified. Like us, that can be an occupational health nursing practitioner as well as primary healthcare practitioner. You can be only wound care. Just
Yes.
do wounds
Focus
for
on
her.
that, for example.
Focus on wound care.
Yeah.
Focus on postnatal.
I even saw a
Focus on
nurse. I
antenatal.
even saw a nurse-led practice opening up a subacute facility, where there was a doctor involved, obviously for oversight, But I saw all these innovative models. I mean, you're talking about occupational health and safety. I mean, those allow for fairly sizable practices to be created. Real enterprise value for practices to be able to create. And so this is very exciting to see all this. And I do have to ask, how have doctors received the nurse-led practices? How do they kind of coexist beside you, given that you're both in the primary care sector?
Initially, when we started, obviously there's a lot of criticism, or there's a lot of what are they doing? Can they even do it?
Clarity needs to be had.
So there was a lot of that initially, but I believe there's a role for doctors, there's a role for nurses, like every person in the healthcare profession, there's a role for everyone. So I believe that doctors have their role to play in the primary healthcare sector, and nurse-led practices has their role to play in the primary healthcare sector. But not only in the primary healthcare sector, in the healthcare sector.
In general.
There's a role for nurses, there's a role for doctors, there's a role for everyone. So the most of doctors or nurses or even clients out there don't know that nurses can actually independently practice. So nurses can independently practice just like doctors can independently practice, as long as you practice within your scope of practice.
Yes, yeah. And I think that is the thing that probably has a lot of people confused, is exactly what is a scope. And I'm not going to go into that discussion with you here today, because that's not the point of today's discussion. Maybe I'll get a representative of SANC to maybe come on board for that kind of discussion.
Yes, please.
But for today, I mean, we're unpacking sort of just the journey, and the challenges that the nurse entrepreneur faces, With that being said, there's obviously this big gap between the public sector and the private sector. I mean, the private sector only servicing about 15% of the South African population, and the public sector servicing about 85%. And what I have found is that nurse-led practices are able to fill that gap a little bit more easily at the primary care level than maybe a doctor would be able to, just with the sheer volumes and numbers that they need to see and just how few of them there are. With nurses possibly coming into that gap, I think it creates that market and creates that bridge essentially where a patient can access that healthcare more readily and more easily than would if they had to go to a doctor, because the fees are maybe a bit more expensive. Not to say that nurses, I saw some nurse fees as well. They can also get expensive. But maybe just speak to us about those kind of trends that we're now seeing. And do you think that nurses can fill that gap?
I think nurse-led practices can fill the need for healthcare services. Nurses can go into communities that needs the services most. When I say nurses can go into communities, there's a lot of communities that some people don't want to go into. So I believe the sustainability of my model is, or my clinics is, and my practices is because we actually go where there's a need.
Sure.
So most of the communities do have day hospitals, they do have public sectors, they do have private practices there, but there's still a need. There's still a need. So nurse-led practices can effectively address that need. So nurses need to open practices first where the service is needed and the demand for services. So if you go to a community where the services is actually needed, it doesn't matter the social status of that community. Your services will be needed. Your services will be in demand.
To be welcomed.
And it will be welcomed by the community.
Wow. Okay, so let's inspire a nurse entrepreneur today. So a potential nurse entrepreneur is listening to what we have to say, maybe watching us on screen right now. And they want to get started. Now, you mentioned earlier in our conversation that when you started out, there was no blueprint. There was no guideposts that you could look to. There were no guidelines that you could follow, what's the first thing you would say to a nurse who is actually looking to start this journey? And I'm not just talking about the practical steps. I'm talking about maybe some of the inner working that needs to happen. Like, what are some of the challenges they're going to face? Maybe from a psychological perspective, from a legislative perspective, and also from a financial perspective. What are the first steps you would say that person needs to address?
I think it's first of all a mind shift. And actually, if you want to do it, a lot of people want to go into business, but are they willing to take the risk involved and also be bold
Sure.
in doing this? So I would say, first of all, is a mind shift, changing, and then also reading up, getting all the necessary skills. See, what am I good at? Am I a good wound care nurse? Am I good at putting up IV drips? I'm just for instance saying, referring to that. Am I maybe good in primary healthcare services? What is my specialty? Because you can be a midwife.
Yes.
So I know a lot of advanced midwives that has their midwifery practice open. So you can see what is my skills and what can I offer. And then you need to then go to the compliance for what you're choosing to do.
Yes.
So if whatever you choose to do as a compliance, if you decide to do occupational health, there's compliance within occupational health. If you need to do primary health care, there's compliance in terms of doing primary health care. So you need to then go to see how you can address the compliance as a nurse, starting a practice in that specific field. And then there's a lot of, I would say, when I do my workshops for nurses in business workshops, I tell nurses that starting your own business or starting a practice or have a nurse-led practice is not always to say you're going to open up a big practice, you're going to put a container down, or you're going to open by a shop. It is just, you can just go do mobile services, postnatal.
Yes.
Mummies that were discharged from hospital, you go see the mummy, you go see the baby. You can go do guides on breastfeeding. There's a lot of ways a nurse can actually run effectively a practice.
Yeah.
And then I would say plan. You can't now be full-time in working full-time. I took like 3 years before I went full-time into practice. If you need to make sure you have a clientele, you need to make sure there's a demand.
Yes.
You need to make sure that you are financially secured. If you are full-time working and now going into business, you just leave your job and there's no backup plan, or you don't have a financial plan for the next few months in terms of how you're going to cope and survive.
Yes.
In the meantime, while your business is growing, or you need to start both at the same time. And while what I tell also the nurses in the workshops with me, I say to them, nothing stops you from starting while you're working.
Yes.
You can start with your equipment. If you know, you need to have a plan to say, in the next year, in the next 2 years, in the next 6 months, I'm going to start my practice. The equipment is not cheap. If you're going to be an occupational health nurse, to buy that sets the equipment, the audio, the audio.
You say you're going to sit there with
and the spiral
deep breaths. Yeah.
If you're going to buy the equipment, you're going to say, oh my word.
Yeah.
And so if you're going to buy the equipment, if you're going to buy the laptops, if you're going to buy all these systems, it takes money. So either you're going to say, I'm going to save 100 Rand or 200 Rand towards my goal. I'm going to so long try to purchase my equipment. I'm putting this away. So this is where I'm heading towards. I'm heading towards actually opening my own practice. So you can start while you're working.
Yeah.
If you cannot leave your permanent job and going into a full-time practice.
And I mean, yes, when you think about the sheer skills gap that sometimes exists there, sometimes people think that they have to go all or nothing, and you don't have to do that. You can start incrementally. You can start putting a little bit away toward your dream. And you were talking about the equipment. That's before we even get to the services. You have to have an accountant. You have to have legal drawn up.
Yes.
If there's a marketing skills gap, you need marketing involved as well, so you can actually get the word out about your practice. There's so much more additional things that goes into running a practice that we as, not never mind just nurses, but as medical practitioners are not taught, And so and I'll get to your workshops and your big conference that's coming up as well in a minute, but just with the general skills gap, do you think that should be something that is taught at a university level? Do you think that should be part of the curriculum, that this kind of information is shared amongst practitioners?
Currently, nurses are not being taught on how to open their own practice.
Yeah.
So a business model is not part of the undergraduate or the postgraduate qualification. And I know there's a student currently doing a PhD because he was referencing my book about how they can actually incorporate a program
Yes.
for nurses and how to open their business, basically teach nurses business skills.
Yes.
And using people that are already in the industry actually as references on how to structure that
Real
program.
stories. Yeah.
Real stories.
not theory. The real learnings.
So currently in the South African curriculum of there's no business model or there's no structure or way for nurses to be taught on how to open their own practice.
You're also part of a association or collective of private nurses. What is the association called, and what do you do there?
So I am the director of Nurse Entrepreneurs Movement. It's a movement that I'm running to support nurses in business. And that movement has been existent for plus minus 4 years. It's that movement we use as a platform to train nurses on how to open their practices, how to open their business, and also as a mentor. We serve as mentors for nurses that actually has already opened their practices. And then the Society of Private Nursing Society. I'm currently a treasurer for the Cape Town region or for the Cape Town branch. And I would love to use what I learned over the years with the skills of nurses that's been there for long in the industry to actually empower nurses.
So you got to a point where you're like, okay, this doesn't exist. I'm going to do something about it. I'm going to create a forum, my own forum, Nurses Entrepreneurs Movement, and we're going to get involved in another forum as well where I can have further impact. So well done to you. I mean, and I've attended your events. They're really great. And I've really just enjoyed the energy in the room with those particular events. And you can see there's a buzz of excitement. People are excited about this journey that they're about to go on. And the level of camaraderie in the room as well, that they're supporting each other. It's a community really, you know? And so, I mean, with all that going on and with all the information that they get given in those conferences, what do you find are the most powerful piece of information that people have come back to you and said, wow, I'm so happy I came here because I learned that?
I actually think it's the thought that they can do it. That they can do it and they can be successful at doing that. Because that was initially my first biggest challenge or fear, I can say, is can I actually do this?
The imposter syndrome.
Can I actually run my own practice? Can I actually be financial sustainable? Can it be sustainable for me financially? Because I have children to support, I have a house to support. And can I actually make it a success? So I think that is seeing in the room, there's other nursing practitioners that has done it or have done it. They see that this person is actually doing it successful and she's doing it full time.
Yes.
And I think that rubs off. And I think that actually just them seeing that I can actually do it, because there's nurses that's been having dreams for years.
Wow.
And they've been sitting on their dreams, and actually seeing them attend the conference and actually walking out there bold and actually opening their practice. I have so many nurses that attended our workshops that actually opened their own midwifery practice, that opened their postnatal practice, that opened their primary healthcare practice, that opened their home-based care services. I have nurses all over South Africa that attended our workshops that's actually implemented what they've learned with the help, obviously, of the movement and obviously with the help of the book that I've written to open their practices.
What's the name of your book?
Nurses in Business.
Okay. Do you have a link where we can purchase it?
It can be purchased through Jutta.
Okay,
it is
super.
published through Jutta.
All right. If you have a link, then please I'll put it in the show notes and nurses will be able to get it there. This is a powerful platform you've created here. It fundamentally changes the way that nurses think about what's possible for them. And as someone who's worked alongside nurses in ICUs for over a decade myself, I have come to understand that they are some of the most resilient, strongest, passionate, deeply caring people that you could ever come across. Yes, of course, you're going to get the occasional nurse that's burnt out. That you're going to wonder, like, she shouldn't be a nurse right now, you know? She probably was passionate, but that passion is gone. But on the whole, my experience has been so positive with them, and to know that they now can be empowered to start their own practices is such a comforting thought for the future of South Africa. You have a conference coming up, a conference that is, from what I can see and from what you've told me about it, is going to be a landmark event. Please tell us about the conference. When is it going to be? Where is it? And what will people learn? Why should they not miss out?
So we've decided to actually have a mega conference, a Nurses in Business conference in Cape Town. I've been seeing these conferences happening in Pretoria, in Johannesburg, but we are actually bringing it to Cape Town. We aim to see 100 plus nurses at that conference. That is nurses that has already started their practice. That is nurses that is thinking of starting their practice, or maybe halfway in opening their practice.
Off and off, yeah.
And we actually are bringing in suppliers. We are bringing in people that can assist you on how to open your practice. We are bringing in suppliers, pharmaceutical companies, financial services. So we're bringing all these resources together.
Yes.
To assist a nurse that is already has a practice, to assist a nurse that's still thinking of her own practice,
Yes.
and also for the nurse that's halfway in the practice. But this Nurses in Business conference is not only for nurses, it's actually a business conference as well.
All right.
So if you in the healthcare field and you have your own business, it's a very good platform to actually connect.
Okay.
To get more systems in place and also to network.
Yes.
And the conference is also, we'll be having a gala dinner with the award ceremony. So we are going
fantastic.
to award nurses for their great work
Wonderful.
in nursing at
Fantastic.
that conference.
Yeah.
So I invite everybody to come. Please don't miss out.
Yes.
It's going to be the 30th of May, 2026 at the Blauberg Hotel.
Fantastic. I'll put the link in the show notes as well, so people can find can get their tickets before, because you only have 100 spots available, right?
Yes.
Tickets are going to go fast, so you better get on.
It's already going.
If I think about the nurse entrepreneur and I think about the fact that they work in primary care, many referring or specialists or allied health or complementary health services that work alongside primary care should really also give the nurse entrepreneur a visit. I mean, I would imagine they see things like back pain, so they could refer on to a physiotherapist, audiology issues, so they can refer on to an audiologist, ENT issues, so they can refer on to an ENT. What would you say to any of your colleagues, perhaps, on what they should do with regards to engaging a nurse entrepreneur? And do you agree with my statement here that you see a lot of these things and you're looking for people to refer to?
I'm actually looking for people to refer to.
Wow. Okay.
So I'm actually looking for people to refer to, and this is a great idea. I was thinking of a network referral for within your space, within your area that you're practicing.
Yes.
So that is the next step, to actually look into a network, because if you're doing occupational health, you need to refer to audiologists. If you need to refer to a physio.
Yes.
And this specific clients is maybe not, they don't have medical aid, maybe. Some have medical aid, some don't have medical aid, but they do have funds.
Yes.
They do have funds to pay for the physio session. They do have funds to pay for whatever other services they do require.
Yes.
But the next step, it's great that you're mentioning it here. It's actually, my next step is creating a network within the area that you are practicing.
Yeah. Well, I think with our firm Medical Insight, we must talk and see if we can collaborate in setting something like that up. It's I think it could be something quite powerful, where just nurses get integrated into the larger private sector, because I think that there's a lot of formalization around other elements of it.
Yes.
GPs referring to specialists, GPs referring to physios, GPs referring to OTs, but as primary healthcare practitioners yourself, you should be involved in that conversation.
We should be involved in that conversation.
Yeah.
And we should be part of the network. Hence, we decided to have the Nurses in Business mega conference to network, and also to get all nurses that's in private practice, those still in public practice that want to come to private practice, or those that's thinking of opening the business, to get them in one room.
Yeah.
And we invite all other healthcare professionals become part of this network.
100%. I want to talk a little bit about the actual lived journey that you found with the new starter practice. So we spoke a little bit about you getting to that tipping point where you decide to leave your full-time occupation and get into your private practice full-time. In that first year or two of business, what was the lived experience? What were some of the challenges, some of the highs, some of the lows? And as you had to get into things like hiring staff, submitting taxes, and dealing with other levels of compliance, like what were some of the places where you knocked your head and some of the experiences you had that were positive?
I think initially I just wanted to pay the receptionist.
Cover the bills.
I just wanted to pay the salary of the receptionist, basically cover the bills,
Yeah.
until we can be financially sustainable and we can actually see a profit. So the first year or two, I actually outsource. I outsource to accountants. I outsource to companies that can actually help me because remember, I've been a nursing practitioner. I knew nothing about business.
No, 100%. Yeah.
So now I can actually advise people on how to be compliant and how to register and on what processes or steps to take. But back in the days, or when I was in my first year, I had to outsource these services, most of these services, because I didn't know how to do it.
Yes. Yes.
And today, I think with technology, things are made easier. I think with technology improving, things are made easier. Things that we had to struggle way back into paperworks, into stuff, Google documents. It went longer. It took some time.
Yes.
But I think, first of all, if you do your application for your permits, it can take a long time to get, but eventually you get it. But that was way back.
Yes.
Now the waiting period is shorter.
That's fantastic.
There's a waiting for your permits to get your permits done. It's shorter. There's companies that you can actually use to collect those permits for you, because if you're not based in Pretoria and you're based in Cape Town, or you're based in another province, there's actually companies that actually do the work for you. Just pay them, you fill in your application. So you see, there's more nurse-led practices. So you can even open your practice just by ensuring that other nurses get permits.
100%. I mean,
that open their practices.
Yeah.
So one nurse has actually decided to do that.
Oh, wow.
So she actually decided to open her own practice to help nurses to get their practice numbers easier.
Yes.
And also to help nurses to assist nurses in terms of getting their permits. But I would say the first year, there was a lot of struggles, or there was a lot of things that I need to externally let other people do for me so that I can learn and then I can do it myself.
Yes.
But the first year is to make sure that you can actually build up your clientele, that you can maintain your clientele, that you can pay your bills, and then you become profitable
thereafter. So having the correct expectations of the journey you're about to go on is critical to your success, because if you're thinking you're gonna buy that new car or buy that new house on year one because, you're a CEO now, you might end up in a situation where you're disheartened because it's tougher than what you thought it would be.
Yes. So the few years of my business, I did not give myself a salary. Then I afterwards realized, no, Cleo, you need a salary.
Yes.
You need to pay yourself a salary. So if you, that nurse that just started your practice and you don't have a salary yet, it took me a few years to get my own salary, to get actually a salary from the company. So it took about 3 years or so for me to get a salary from the company, and then to know that I am the owner, but I'm also employed by the company.
Yes.
And then I need to get my salary monthly. I need to get my pay slip to apply for that car. And then I need to make sure the company is compliant.
Yeah.
I need to make sure that everybody is paid, and so all those little things of running a company, running your payroll, running all those things. It's things that I've learned along the way in the second year of starting my businesses.
Yes.
But now it's
second nature.
It's part of who we are.
Yeah.
It's part of how we operate. So it doesn't mean that if you are a nurse or a nurse-led practice that you're not a business, that you're not a successful business, or you cannot operate within the business space or in the legal space.
Yes.
So you can provide your clinical care successfully and also be a successful entrepreneur, a successful business person.
As a final parting question to you, I want you to speak directly to that nurse that's had that dream, that has been scared, that has been frustrated, and just has that imposter syndrome where they just don't feel like they can do it or they belong. If you were to encourage any nurses on the edge right now to make that step and to take that bold leap, what would you say to them?
I would say overcome the fear. I came from a family that my mother was a machinist and my father was a construction worker. So I had nobody to fall back on. I just had to rely on my dream, my education, and the burning in my heart, or the burning or the desire in my heart that I want to be more. If you are that nurse that actually want to open your own practice, I would say the next step is to start. You will never know what is the next step if you don't take the first step just to start. So the first step will be to start. And to start is small steps. It doesn't need to be big steps to leave your permanent job or to leave a stable income. Your first step is small. It can be, okay, I'm opening this company. I'm providing after hour the service. I'm actually saving towards my dream, towards my goal. But to that nurse out there that's actually thinking of starting, today is the day. Today is the day you should actually start.
Sister Cleo, I remain so inspired by you. As a person of color myself with a very similar background to you, it is heartwarming to see us daring to dream in this new South Africa. I want to congratulate you on the success you've had so far, and I want to wish you every success going forward. You have proven to be a real asset, not only to nurses but to the healthcare community at large. And I was so looking forward to having you on this podcast today, and to have these discussions with you, because you are a real true testament to what it means to go out and chase a dream. So thank you so much for your time. I really appreciate it.
Thank you for having me.
And thank you to you, our listeners. It really is an amazing journey that we're on right now with this podcast. Vital Insight now has recorded over 10 episodes. And I think we are getting closer and closer and closer to really understanding where healthcare is at in 2026 and beyond, and where we still need to grow. This conversation in particular is something that I've been thinking about for so long, and I've been wanting to bring to the fore. So if this has been valuable to you, please do share it with a colleague or a friend and have them leave their comments, and you leave your comments as well into what we should maybe talk about next, which guests we should get on next, to share their vital insight. And so please do support us by liking this video, sharing and subscribing to the channel. The more people that subscribe, the more variety of guests we can get on. Until next time, my name is Basil Adriaanse. It's been a pleasure. Thank you.